Friends, today we are going to study about the ureters, the gross anatomy of the ureters. As you all know, the ureters are a pair of thick-walled cylindrical tubes which conveys urine from the corresponding kidney to the urinary bladder. As you can see here in this picture, this is right kidney, this is left kidney, and here you can see this is the thick cylindrical tubes which are coming from the kidney to the urinary bladder on the both side. This is called ureter. And before going to the detailed gross anatomy of the ureter, let's see some clinical aspect regarding the ureter, why it is important. There is lots of MCQs which comes from the ureter part, and there is a lots of clinical entities which are related with the ureter in different kinds of surgeries. So one day a young man that comes to the emergency OPD and he complains that he has severe abdominal pain in the left flank. Okay, what could be the diagnosis? Pain in the left flank. Now, while the patient was sitting for the treatment, he complains that the pain was getting worse and had moved into the lower region, that is the inner side of thigh and the scrotum. Now, this type of typical pain which is radiating towards the inner side of the thigh and the male or female genital organs, this is called renal colic. For the confirmation of this type of the renal colic, there is lots of investigation. The plain X-ray can be done, or even ultrasound can be done, and we have find that there is a small stone that is impacted in the ureter. This stone is the responsible for the ureteric colic, and the referred pain of this ureteric colic to the inner side of thigh and the male or female genital organs, it is called referred pain of the ureteric colic, which is related to the cutaneous area innervated by the same spinal segment as that of ureter, that is T12 to L2. So this is the first common clinical entity, that is the ureteric colic. Second is injury to the ureters at the different sites. There are four main sites, or you can see the dangerous sites where the ureter can get injured. The point where the ureter crosses the iliac vessels, second is in the ovarian fossa, and third is when the ureter is crossed by the uterine artery. That's why this is the most common clinical in most clinical cases after the hysterectomy or the surgical removal of the ureter. It passes downward and medially below the peritoneum of the posterior abdominal wall and enters in the pelvis by the crossing of the bifurcation of this common iliac artery or just beginning of this external iliac vessels. So this is the abdominal part, just below the lower level of the corresponding kidney up to the crossing of the bifurcation of the common iliac. This is the abdominal part of the ureter. Now coming to the relations of the ureter, this abdominal part of the ureter, posteriorly it is related with the psoas major muscle, as you can see here on the both side. Psoas major muscle along with its fascia and the branches of the lumbar plexus, that is genitofemoral nerve, and the third one is the tips of the transverse processes of the all the lumbar vertebrae. So there is three structures which is related posteriorly to the abdominal part of this ureter, that is the psoas major muscle and fascia, genitofemoral nerve, and the tips of the transverse processes of the lumbar vertebrae. These are the posterior relation of the abdominal part of the ureter. Now coming to the anterior relation of this abdominal part of the ureter. Now this picture is also present in your books also. You can see there. This picture is showing the anterior relation of the both side of the ureter, right and the left. So on the both side, the first common structure that is covering this ureter, abdominal part of the ureter, that is a parietal peritoneum. Second, now come to let's see the right side. First see the anterior relation of the right ureter, and then we will see the left ureter. On the right side, the first is a parietal peritoneum and the second is a right gonadal vessels. This one, the right gonadal vessels and right colic vessels and the ileocolic branches of the superior mesenteric vessels. So the first one is parietal peritoneum, second is right gonadal vessels, third is right colic vessels, and the fourth is root of mesentery. This is the root of mesentery, which is related anteriorly to the right ureter, and the terminal part of the ileum. And here you can see this is another important structure, that is the second and the third part of the duodenum. So from above downward, second and third part of the duodenum, right colic vessels, ileocolic vessels, right gonadal vessels, and the root of mesentery and the terminal part of the ileum. These are the structures related anteriorly to the right ureter, mainly in the abdominal part. Now come to the second, that is a left ureter. The common one is parietal peritoneum. Second is left gonadal vessels, left colic vessels, and sigmoidal branches of the inferior mesenteric vessels. And the last one, that is the apex of the inverted V-shaped attachment of the sigmoid mesocolon. So on the right side there is root of mesentery, and on the left side inverted V-shaped apex of the sigmoid mesocolon. So these are the structures which are related on the left ureter anteriorly. So this is all about for the posterior and the anterior relation of the abdominal part of the ureter on the right side and on the left side. Now come to the third one, that is the pelvic part of the ureter. इसके कोर्स की बात करें तो at first this ureter passes downward below the peritoneum of the lateral pelvic wall along the anterior margin of the greater sciatic notch. We can't see here, but you can see in another picture, that is along the anterior margin of the greater sciatic notch and reaches the level of the ischial spine. And this is known as the vertical part of the pelvic part of the ureter. As it aligned vertically, this is called vertical part. Okay, it is up to the from crossing to this common iliac artery up to the ischial spine. This is vertical part of the ureter in the last static pelvic part. The second part is oblique part of the pelvic part of the ureter. Now to show this pelvic second part or the oblique part, I have taken this picture which is showing the superior view of the pelvis or the pelvic organs. In this you can see this is the pubic symphysis. Just behind the pubic symphysis there is bladder, this uterus, ovaries, fallopian tube, and this is rectum. So this is the superior view of the pelvis, and showing this oblique part of this second part of the pelvic part of the ureter. So from the ischial spine, this ureter passes forward and medially through the extraperitoneal tissue above the levator ani muscles and reaches the superior lateral angle of the base of the bladder. Here this is uterus. It goes anteriorly to the uterus towards the base of the bladder wall and opens into the interior of the bladder, urinary bladder, and this is called the second part of the ureter. Now come to the third part, that is the intravesical part of the ureter. Finally, the oblique part of the ureter that enters or the pierces the musculature of the bladder and goes downward and medially through the bladder wall and opens into the interior of the bladder. This is the intravesical part. The ureteric openings of these two, they are generally 2.5 centimeter apart. Okay, in a contracted bladder. When bladder is empty, this is 2.5 centimeter apart, but when the bladder is full, this distance is increased about 5 centimeters. Okay, so this is the two openings of the ureter finally into the bladder. This is the third part or the intravesical part of the ureter. This is the lateral view of the pelvis, showing anteriorly pubic symphysis, the bladder and the uterus and the rectum, and you will see the final or the terminal part or the third part of the ureter that enters into the bladder wall.